Meet Logan Donaldson, a spring 2023 graduate and former health science pathway student, as he shares his personal journey and experience with a CAO. What did you study before the CAO?
I did 2 years of medical sciences at Brock University, before transitioning into the program at the CAO. And I was part of a co-curricular program there called Med Plus as well, that kind of exposed us to a variety of healthcare professions, throughout the 2 years that I was there, and showed me a variety of disciplines that I could go into. But a few different tracks kind of led me to osteopathy, and I'm obviously very glad that they did.
How was the CAO different from your previous education?
The biggest difference is that all of the curriculum and all of the course content is really tailored to what is going to be applicable and useful in clinical practice. So there's no excess courses. Everything is really structured to prepare you for professional practice. And all of the courses integrate into one another so that you're always adding portions from different courses together to understand better what osteopathy is all about and all of the nuance behind it. And so the efficiency and the um, the cohesiveness of the curriculum is definitely the biggest difference.
Were you able to work with the school schedule?
So yeah, the schedule worked great as a young person trying to pay their way through school. At times having up to 3 or 4 jobs at a time, but still managing to balance everything out is not easy. But if you're in a situation where you need a consistent income, then it's definitely doable, and you can make all of that work at the same time.
How did the curriculum layer as you progressed through the program?
Yeah, the it's cool looking back at it now because you really get an understanding of how different concepts are laid out through the program to build on one another, and the foundations of information that you get within each year constantly stack up and create a very cohesiveness understanding of what osteopathy is and how it needs to be done in the office. And now being on the teaching side of that, I see how that process is constantly being made more efficient and adapted to the betterment of the student experience, and making sure that everyone has an even better understanding and ability to apply the principles of osteopathy once they do exit the school.
How would you describe your experience with the CAO faculty?
The faculty's been great. I felt very supported throughout my time. I was always uh, a person that asked a lot of questions, and what was really cool about the faculty interaction is that they inspire you to think for the answer yourself rather than giving you all of the facts. They give you the opportunity and the information you need to uh, understand and experience the answers to your questions individually, and that's a huge difference because in different clinical scenarios during professional life, you're going to have to problem solve on the fly and find those answers for yourself. And the interaction with the faculty really supports that process.
How was your experience in the public clinic?
Absolutely, yeah. One of the biggest things that prepares you for professional life is most certainly the public clinic. You see such a variety of patients with a diverse array of healthcare conditions, and you can really get to see what osteopathy can do to help the body manage those conditions, and it really prepares you for whatever's going to walk into your office once you are in professional life. Um, it really can't be overstated how much diversity and what the experience does to prepare you for clinic life.
How has the CAO prepared you for professional practice?
Yeah, and you're obviously always a little bit apprehensive when you make that jump from school into professional life, but once you do, you kind of realize as different clinical scenarios come up, just how well prepared you are, because we've explored so many of the possibilities and so many of the situations that you're going to be in, and you've not experienced each situation individually, but you have the tools to handle those situations however they arise. And I feel like the preparation was rigorous and comprehensive, and I haven't come across anything that I wasn't able to handle in a professional and effective manner up until now.
Have you been fully recognized by private insurance?
Absolutely. I've never had any issues with private or extended healthcare plans. Osteopathy seems to be very well sought after by patients and therefore by insurance companies that wish to offer the most competitive plans for their to employers. So I've never had any issues with that.
How has your practice grown since graduation?
No, better than expected. Like I said, you always have apprehension when you're going from school to the professional life. But I think my first week, I had about 10 patients, 10 or 11, and I'm now seeing 70 to 80 patients a week. And the practice has grown to a point where I need to add another colleague to my team so to accommodate the demand for osteopathic treatment. I come from a rural area, and my practice has done really well, and I look forward to kind of continuing to grow at the same rate that I have been.
Would you recommend the CAO?
Well, osteopathy is a very rewarding career. You get to be a huge part of your community. I find that there's so much value in what I provide to my patients, and that also allows me to continue to grow and try to improve the service that I provide. But it affords you a rewarding career. It's helped given my family, my young family, just my wife and I and dogs, a incredible life so far. Just 2 years out of school, one that I never would have thought would be possible until the wheels started turning after graduation. But it's not an easy process. Osteopathy was the hardest thing that I've ever had to learn, but it's also been the most rewarding.
Describe your experience with the hands-on training.
Yeah, well, that's the great thing about the CAO is the amount of hands-on training that we get. You really go from not understanding how to palpate tissue or structure whatsoever to having thousands of hours of experience, and that entirely prepares you for what you're going to find in clinical life. Um, the uh, the amount of hands-on time is remarkable.
Would you recommend the CAO?
Yeah, I wouldn't put my education with anywhere else. That was a question as I was choosing a school to come to in the beginning, but upon a small amount of research, it was obvious to me at least that there was only one clear choice, and that was the CAO. And I couldn't overstate how happy I am that I made that choice.
Ready to begin your journey in osteopathy? Study at either our Hamilton or Calgary campus. Book your personal call today.